Bismillahirrahmanirrahim. Diabetes mellitus. The first clear and complete description of diabetes mellitus was made by Acidosis of Cappadocia. He was from Acidosis, the scientist. He was from Cappadocia, ancient district in the East Central Asia in the 1st century, who described the disorder as the intense thirst of these patients and melting down of flesh into the urine, and attributed the origin of the term diabetes to the Greek word for meaning through in a siphon. It is a combination of two words, diabetes meaning to pass through and mellitus meaning honey. It means melting of the flesh and limb. Melting of the flesh and limb and passing through these in a siphon means passing of flesh and limbs in urine. The word mellitus was added to diabetes because of the sweet nature of urine in this disease, and this was discovered by the William. In the 17th century, William recognized the sweetness of urine as if this was bean sugar and honey in it. Dobson demonstrated the actual presence of sugar in the urine in 1775, and Ambrosen in 1835 first showed that the blood of diabetic patient contained more sugar than normal, thereby establishing hyperglycemia as the essential feature of disorder. Preparation of insulin by Banting and Best. The modern scientific study of disorder began with the classic study of Claude Bernard on the blood sugar and glycemic function of the liver, which culminated in preparation of insulin by Banting and Best in 1921. The Banting and his assistant Best and the first dog which was treated by insulin, and he is the first person on man, Thomson, who was treated with insulin, discovered by the Banting and Best. Diabetes mellitus is a syndrome of impaired carbohydrate, fat, and protein metabolism caused by either lack of insulin secretion or decreased sensitivity of the tissue to insulin. Diabetes is when body is unable to utilize the glucose, mean sugar in the body efficiently. This may be due to body either not making any or enough insulin or is resistant to insulin. There are three main types of diabetes: type 1, type 2, and the third one is gestational diabetes. Diabetes can occur at any age. Type 2 diabetes, which was previously known as adult-onset diabetes, is now being diagnosed in young children, which was previously unheard of. Type 1 diabetes, also called insulin-dependent diabetes mellitus and shortly called IDDM, is caused by the lack of insulin secretion. It is important to note that type 1 diabetes is an autoimmune condition or caused by viral infection where the body attacks its own beta cell in the pancreas that make insulin. In some instances, there may be a hereditary tendency for beta cell degeneration even without viral infection or autoimmune disorder. The usual onset of type 1 diabetes occurs at about 14 years of age in the United States, and for this reason it is often called juvenile diabetes or young age diabetes mellitus. However, type 1 diabetes can occur at any age, including adulthood, following disorder that lead to destruction of pancreas beta cell. It is not a condition that can be prevented, but can be well managed through medication, diet, and lifestyle. When the lifestyle is changed, the diet is changed, and use of medication, we can control this disease but cannot prevent it. Type 1 diabetes may develop abruptly or a period of few days or week without three Type 1 diabetes may develop abruptly over a period of a few days or weeks with three principal sequelae: increased blood glucose, increased utilization of fat for energy and for formation of cholesterol by the liver, and depletion of body protein. Approximately 5 to 10% of people with diabetes mellitus have the type 1 form of the disease. Type 2 diabetes, also called non-insulin dependent diabetes, in short it's called NIDDM, is initially caused by decreased sensitivity of target tissue to the metabolic effect of insulin. This reduced sensitivity to insulin is often called insulin resistant. Gestational diabetes. Gestational diabetes is temporary and occurs during pregnancy due to hormonal change and fetal requirement. This type of diabetes occurs during pregnancy, and when the pregnancy is over, hyperglycemia also comes down. However, having gestational diabetes can increase the risk of developing type 2 diabetes by 50 to 60% in the future. Effects in both type of diabetes mellitus, metabolism of all the main foodstuff is altered. The basic effect of insulin lack or insulin resistance on glucose metabolism is to prevent the efficient uptake of utilization of glucose by most cells of the body except those of the brain. As a result, blood glucose concentration increase, cell utilization of glucose falls increasingly lower, and utilization of fat and protein increase. Effect of high level blood glucose concentration. The lack of insulin decreases the efficiency of peripheral glucose utilization and augments glucose production, raising plasma glucose level up to 300 to 1200 mg per 100 ml of plasma. This increased plasma glucose then has multiple effects throughout the body. These effects are loss of glucose in the urine. The high blood glucose causes more glucose to filter into the renal tubule than can be reabsorbed, and exchange glucose spill into the urine. This normally occurs when the blood glucose concentration rises above 180 mg per 100 ml, a level that is called the blood threshold for the appearance of glucose in the urine. When the blood glucose level rises to 300 to 500 mg per 100 ml, 100 or more grams of glucose can be lost into the urine each day. Increased blood glucose causes dehydration. The very high level of blood glucose, sometimes as high as 8 to 10 times normal in severe untreated diabetes, can cause severe cell dehydration throughout the body. This occurs partly because glucose doesn't diffuse easily through the pores of the cell membrane, and the increased osmotic pressure in the extracellular fluid causes osmotic transfer of water out of the cell. In addition to the direct cellular dehydrating effect of excessive glucose, the loss of glucose in the urine causes osmotic diuresis. That is, the osmotic effect of glucose in the renal tubule greatly decreases tubular reabsorption of fluid. The overall effect is massive loss of fluid in the urine, causing dehydration of the extracellular fluid, which in turn causes compensatory dehydration of intracellular fluid. Thus, polyuria means excessive urine excretion, intracellular and extracellular dehydration, and increased thirst are classical symptoms of diabetes. Chronic high glucose concentration causes tissue injury. When blood glucose is poorly controlled over a long period in diabetes mellitus, blood vessels in multiple tissues throughout the body begin to function abnormally and undergo structural changes that result in inadequate blood supply to the tissue. This in turn leads to increased risk of heart attack, stroke, end-stage kidney disease, retinopathy and blindness, and ischemic and gangrene of the limb. Chronic high glucose concentration also causes damage to many other tissues. For example, peripheral neuropathy, which is abnormal function of peripheral nerve, and autonomic nervous system dysfunction are frequent complications of chronic uncontrolled diabetes mellitus. These abnormalities can result in impaired cardiovascular reflex, impaired bladder control, decreased sensation in the extremity, and other symptoms of peripheral nerve damage. In addition, hypertension secondary to renal injury and atherosclerosis secondary to abnormal lipid metabolism often develop in patients with diabetes and amplify the tissue damage caused by elevated glucose. The shift from carbohydrate to fat metabolism increase the release of acidosis such as acetic acid and beta-hydroxybutyric acid into the plasma more rapidly than they can be taken up by oxidized by the tissue cell. As a result, the patient develops severe metabolic acidosis from the excess ketoacidosis, which in association with dehydration due to excessive urine formation can cause severe acidosis. This leads rapidly to diabetic coma and death unless the condition is treated immediately with large amount of insulin. Metabolic acidosis, all the usual physiological compensation that occur in metabolic acidosis take place in diabetic acidosis. They include rapid and deep breathing, which cause increased expiration of carbon dioxide. This buffer acidosis but also deplete extracellular fluid bicarbonate stores. The kidney compensate by decreasing bicarbonate excretion and generating new bicarbonate that is added back to the extracellular fluid. Although extreme acidosis occur only in most severe instances of uncontrolled diabetes. When the pH of the blood falls below about 7, acidotic coma and death can occur within hours. Change in the electrolyte of diabetic blood. Excess fat utilization in liver occurring over a long time cause large amount of cholesterol in the circulating blood and increased depletion of cholesterol in the artery and increased deposition of cholesterol in the arterial wall. This leads to severe atherosclerosis and other vascular lesions. These changes occur in normal level is 100 mg per deciliter. The electrolyte changes which occur in acidosis is up to 400 mg per deciliter. In ketoacidosis, normally the ketone are 1 milliequivalent. In ketoacidosis, it is increased to 30 milliequivalent. Total cations are 155 milliequivalent. In ketoacidosis, it falls to 130 milliequivalent. Bicarbonate normally in plasma, normal plasma level is 27 milliequivalent, and in acidosis it falls to 5 milliequivalent. Chloride is 103 milliequivalent and falls to 90 milliequivalent. And pH of blood, which is normally 7.4, falls to 6.9. And cholesterol level, which is 180 mg per deciliter, rises up to 360 mg per deciliter. Diabetes causes depletion of the body protein. Failure to use glucose for energy leads to increased utilization and decreased storage of protein and fat. Therefore, a person with severe untreated diabetes mellitus suffers rapid weight loss and asthenia, lack of energy, despite eating large amount of food, polyphagia. Without treatment, these metabolic abnormalities can cause severe wasting of the body tissue and death within a few weeks. Type 2 diabetes, resistance to the metabolic. Type 2 diabetes, resistance to the metabolic effect of insulin. Type 2 diabetes is far more common than type 1, accounting for about 90 to 95% of all cases of diabetes mellitus. In most cases, the onset of type 2 diabetes occurs after age 30, often between the age of 50 and 60 years, and the disease develops gradually. Therefore, this syndrome is often referred to as adult-onset diabetes. In recent years, however, there has been a steady increase in the number of young individuals, some young than 20-year-old with type 2 diabetes. This trend appears to be related mainly to increased prevalence of obesity, the most important risk factor for type 2 diabetes in children and adults. Obesity, insulin resistant. Type 2 diabetes, in contrast to type 1, is associated with increased plasma insulin concentration, hyperinsulinemia. This occurs as a compensatory response by the pancreatic beta cell for diminished sensitivity of target tissue to the metabolic effect of insulin, a condition referred to as insulin resistant. The decrease in insulin sensitivity impairs carbohydrate utilization and storage, raising blood glucose and stimulating a compensatory increase in insulin secretion. Symptoms of diabetes mellitus. Symptom 1 is frequent urination and excessive thirst. Frequent urination or polyuria is a common symptom of diabetes. This should, however, be differentiated from occasional frequent urination caused by excessive intake of fluid like alcohol. Polyuria associated with diabetes is a continuous condition that is not strictly dependent on the amount of liquid taken. Besides, the condition during night makes several visits to the bathroom. Excessive thirst. Frequent urination is caused by the overactive kidney trying to rid the body of excessive sugar in blood. But as you urinate more, your body tends to get dehydrated. To replace the fluid, you experience excessive thirst. The combination of frequent urination and excessive thirst is an indication that could be having diabetes. Symptom 2, increased hunger. Excessive hunger, also called polyphagia, that occur although haven't skipping meal counts among the main diabetic symptom. In the absence of adequate insulin, the glucose cannot get into body cell. This leads to lack of energy, which the body translates to a need for food, hence the excessive hunger. However, because the more food eat, the more the sugar in the blood stream without a change in the sugar entering cell, the hunger will remain. Symptom 3 is fatigue. As in diabetes, cell does not get enough glucose to break down for energy production. This lack of adequate energy presents as fatigue, unable to carry out ordinary activity. Left untreated, it can lead to more serious complications, including death. Symptom 4, numbness. Numbness, tingling, or pain in the finger, hand, and toes are some of the early symptoms of diabetes. These signs arise due to increased blood sugar level, which slow down blood flow and thereby affect the nerve in the extremities. At first, these signs are minor and occasional. However, as the condition worsens, they become more pronounced so that they are more intense and regular. Over time, the numbness, tingling, and pain may spread to other areas, including leg, arm, and more of the nervous system. The numbness may also adversely affect movement. This progresses up Symptoms may take months or even years, during which time nerve damage continue and may also involve wasting of muscle in feet and hand. Symptoms 5. Headache. Both hypoglycemia, low glucose level, and hyperglycemia, high glucose level, can cause headache. Symptom 6 is sexual dysfunction. Diabetes interferes with flow of blood in the body and cause nerve damage. When the nerve to the sexual organ are damaged and blood supply is compromised, these organs cannot perform normally. Besides low energy for women, the vagina may become too dry for sex, while men may find it hard to get or maintain an erection. If the diabetes remains untreated for long, it can lead to impotency in men. Symptom 7. Bruising and cuts that won't heal. The poor flow of blood in body means that many body tissue and organs are undernourished and weakened. This is the reason why easy bruising occur. Bruising and any cuts or infection in a diabetes. Symptom 8. Unexplained weight change. Diabetes can cause unexplained weight loss or weight gain even though you have not made any diet change. These weight change can be explained in two ways. As we have seen in diabetes, glucose is unable to enter the cell. The body thus goes into the survival mode. It starts burning the protein that make up muscle tissue or for energy. This leads to a serious drop in weight. The body may also react in another way. The high amount of glucose in blood may convert into fat, which is deposited in various parts of the body. This can cause an unexplained weight gain. Symptom 9. Blurred vision. Excess sugar in bloodstream can damage the blood vessel in the eye, including rupture. It may also alleviate fluid pressure in the eye. This interferes with the function of the retina and the optic nerve, responsible for transmitting image to the brain, causing blurred vision. High blood sugar can also cause other vision problems like retinopathy, cataract, glaucoma, and diabetic macular edema. While vision damage may be rectified if addressed earlier, if the diabetes treatment does not commence soon, the eye may be further and permanently damaged. New blood vessels may grow into the eye, blocking out light and image from reaching the retina and optic nerve in particular. This worsens the vision problem and may even lead to blindness. Symptoms 10. Yeast infection. Studies have found that yeast infections are more common in people with diabetes. Yeasts grow better when they have a good source of sugar. It is therefore possible that the higher level of blood sugar in a person with diabetes create a more favorable environment for yeast to thrive. Note that yeast infections are more common in women than men due to their anatomy, and overgrowth of yeast lead to infection like candida in the vaginal region. Recurrent yeast infection is one more diabetic symptom. For the reason, consider going for a test to rule out diabetes. Tests for type 1 and type 2 diabetes and pre-diabetes. A1C test. This blood test, which doesn't require not eating for a period of time, fasting, show average blood sugar level for the past 2 to 3 months. It measures the percentage of blood sugar attached to hemoglobin, the oxygen carrying protein in red blood cell. It's also called a glycated hemoglobin test. The higher the blood sugar level, the more sugar attached with the hemoglobin, and A1C level of 6.5% or higher on two separate tests means that you have diabetes. An A1C between 5.7% and 6.4% means that you have pre-diabetic. Before 5.5% is considered normal. Below 5.7 is considered normal. Random blood test. A blood sample will be taken at a random time no matter when you last eat. A blood sugar level of 170-200 milligram per deciliter, 11.1 millimole per liter or higher suggests diabetes. Fasting blood sugar. A blood sample will be taken after having eaten anything the night before. Fasting blood sugar. A fasting blood sugar level less than 100 mg per deciliter, 5.6 millimole is normal. A fasting blood sugar level from 100 to 125 mg per deciliter, 5.6 to 6.9 millimole per liter is considered pre-diabetic. If it is 126 mg per deciliter, 7 millimole per liter or higher on two separate tests. Glucose tolerance test. For this test, patient is fasted overnight, then the fasting blood sugar level is measured. Then you drink a sugar liquid and blood sugar level are tested regularly for next 2 hours. A blood sugar level less than 140 mg per deciliter, 7.8 millimole is normal. A reading of more than 200 mg per deciliter after 2 hours means you have diabetes. A reading between 140 and 199 mg per deciliter, 7.8 millimole per liter and 11 millimole per liter means you have pre-diabetic. Treatment for type 1 and type 2 diabetes. Treatment for type 1 diabetes involve insulin injection or the use of insulin pump, frequent blood sugar check and carbohydrate counting. For some people with type 1 diabetes, pancreas transplant or islet cell transplant may be an option. Many types of insulins are available, including short-acting regular insulin, rapid-acting insulin, long-acting insulin, and intermediate options. Depending on need, provider may prescribe a mixture of insulin type to use during the day and night. Oral or other drugs. Some diabetic drugs help your pancreas to release more insulin. Others prevent the production and release of glucose from your liver, which means you need less insulin to move sugar into your cell. Still others block the action of stomach or intestinal enzymes that break down carbohydrates, slowing their absorption or make tissue more sensitive to insulin. Metformin, Portamate, and other is generally the first drug prescribed for type 2 diabetes. Another class of medication called SGLT2 inhibitor may be used. They work by preventing the kidney from reabsorption, filter sugar into the blood. Instead, the sugar is eliminated in the urine. Diabetic bariatric surgery. Some people with type 2 diabetes who are obese and have a body mass index higher than 35 may be helped by some type of bariatric surgery. People who have had gastric bypass have seen major improvement in their blood sugar level, but this procedure long-term risk and benefit for type 2 diabetes aren't yet known. Treatment for gestational diabetes. Controlling blood sugar level is essential to keep baby healthy. It can also keep from having complication during delivery. In addition to having a healthy diet and exercising regularly, treatment plan for gestational diabetes may include monitoring blood sugar. In some cases, may also use insulin or oral drug. Monitoring blood sugar level during labor. If blood sugar rise, baby may release high level of insulin. This can lead to low blood sugar right after birth. Treatment for pre-diabetic. Treatment of pre-diabetic usually involve healthy lifestyle. These habits can help bring your blood sugar level back to normal. Treatment for pre-diabetics. Treatment for pre-diabetics usually involve healthy lifestyle choice. These habits can help bring your blood sugar level back to normal, or it could keep it from rising towards the level seen in type 2 diabetes. Keeping a healthy weight through exercise and healthy eating can help. Exercising at least 150 minutes a week and losing about 7% of your body weight may prevent or delay type 2 diabetes. Drugs such as metformin, statin, and high blood pressure medication may be an option for some people with pre-diabetic and other conditions such as heart disease. Low blood sugar hypoglycemia. If your blood sugar level drop below your target range, it's known as low blood sugar diabetes. Low blood sugar diabetic hypoglycemia. If you are taking drugs that lower your blood sugar, including insulin, your blood sugar level can drop for many reasons. These include skipping a meal and getting more physical activity than normal. Low blood sugar also occurs if you take too much insulin or too much of a glucose lowering medication that cause the pancreas to hold insulin. Check your blood sugar level regularly and watch for symptoms of low blood sugar, including sweating, shakiness, weakness, hunger, dizziness, headache, blurred vision, heart palpitation, irritability, slurred speech, drowsiness, confusion, fainting, sneezing. Heart palpitation. Low blood sugar is best treated with carbohydrate that your body can absorb quickly, such as fruit juice or glucose tablet. So thank you. Please subscribe the channel and down the bell icon for notification, and also write down your valuable comments in the comment box for improvement of the channel. Thank you once again. See you in the next lecture.